as part of the initial workup and as actually part of the free assessment, we do imaging of the cornea. So we have a number of different devices. So we have the pentacam, which is a corneal tomographer, and that basically looks at the corneal shape across 4 different maps. And it also has a score, which is like a risk score called an ectasia score for will the cornea become unstable once we remove tissue with the laser. And then we're also really lucky to have an MS39. So that's an Italian-made device, which also gives another perspective on the cornea. So we use it in conjunction with the pentacam, lots of information about the cornea. And that would include things like the corneal thickness. So in really thin corneas, you may not be suitable for laser eye surgery, or you may be a better candidate for PRK as opposed to LASIK or SMILE. We look at the shape of the cornea. So we want to make sure that it's not kind of like this, like a cone shaped, which you might see in a keratoconic eye. And we see that on a number of different scans because that would be a contraindication to having laser surgery. And then we look at if the cornea is dry. So we look at the surface of the cornea to see what the tear film's like. And the MS39 has a really neat function where we can actually map the tear film. And then, we look at all these things together, including the stability of the script to see if you're suitable for laser. And depending on different things, we might push you more towards a PRK option over a LASIK or an LASIK or a SMILE option. And then if you're not a laser candidate, then we might look at doing an implantable collamer lens, which is essentially putting a contact lens inside the eye. So it's intraocular surgery.
So there's a whole alphabet soup of different procedures that eagle eye surgeons can offer people who are looking for vision correction. We probably won't have time to go into detail about all of them.
Basically offer everything. So patients know when they're coming here, they have the whole range of procedures. And then we basically pick 1 or 2 that are best suited for your eyes. So you might have a few options, or you might just have one option, depending on all those factors I just mentioned. And then there's also other factors, but they were the corneal factors that we were talking about.
So is it common for people to be surprised that LASIK isn't suitable for them? I mean, they come to you and maybe their heart's set on LASIK, and then they find out that perhaps a different type of procedure is better for them. Is that a common thing?
Obviously, it can be disappointing if you're coming in and your expectations are that you're going to have LASIK, but lots of people don't actually know about all the other options. So lots of my patients don't actually know about SMILE, which is a great option if you've got dry eyes, or if you're a martial arts or a very heavy sports player because you don't have a flap. We've spoken about SMILE before. And then some patients also don't know about implantable collamer lenses or ICLs. So I think actually when they come here, even if you're not a candidate for one thing, we can usually offer you something else. It's very unusual that we can't offer you anything unless your script's not stable or you're just not suitable at all. So I think it's really exciting that we can offer different options. And at the end of the day, you just got to pick the option that's best for you. You don't want to just kind of definitely have your mindset on LASIK because that might not be the best option.